Hello, my name is Terry Carner. I am a nurse and midwife and I work at Liverpool School of Tropical Medicine. This presentation is on post-abortion care. The learning outcomes include a review of post-abortion care and a discussion on the indications for manual vacuum aspiration, or MVA. You may have the opportunity to practice an MVA during a breakout session in an EOC course or in a skills lab. Complications of unsafe abortion contribute to 8% of global maternal deaths. Therefore, we need a package of care to be able to manage these complications of hemorrhage and sepsis. Post-abortion care is also a time when we can prevent unsafe abortion by promoting contraceptive and family planning. It is also part of the universal access to sexual reproductive health services. The essential elements of post-abortion care include counselling. It is really important to talk to the woman about what has happened, to give her advice about the different treatment options, and to talk to her afterwards. It's also an opportunity to answer any of her questions and gain consent from her. Treatment options include conservative management, medical and surgical interventions. Contraceptive and family planning services are also part of the post-abortion care package, as is reproductive and other health services. It's also important to engage with the community so the community understand the types of services that are provided at the health facility and can become actively engaged in the use of them. When a woman arrives at a health facility with first trimester bleeding, it is important that we make a diagnosis. So we need to think of the different types of bleeding that can occur and make our diagnosis. So this could be because of complications from a spontaneous miscarriage or an unsafe abortion. It could be as a result of a molar pregnancy where abnormal fetal cells have grown in the uterus but they do not form a viable pregnancy. It could be because of cervical lesions, and we need to rule out an ectopic pregnancy where the pregnancy forms in the fallopian tubes rather than the uterus. When making a differential diagnosis of first trimester bleeding, it is good to think of the symptoms and how they present. For example, is pain present? Is it minimal? Is it very severe, or has it settled? Bleeding, there may be none or it might be minimal. It might be heavy or it may have settled. Does the woman still feel pregnant? Have the symptoms of pregnancy reduced? Are they present or are they exaggerated? If you are able to do an ultrasound scan, can you see a viable pregnancy? Is the fetal heart present or is the uterus empty? When doing a cervical examination, is the os closed? Is it open? Are there products of conception visible? And when you palpate the uterus, is it the size for dates? Is it smaller? Is it larger? This will help you make your diagnosis. Now, treatment options. If we consider medical first, we can use misoprostol. Misoprostol is slightly less effective than an MVA. However, it's stable at room temperature, it's cheap, it's non-invasive, and we can administer it at a BMOC. But we also need to ensure that we follow up the woman afterwards. We can also consider conservative treatment, wait and watch. but we need to be prepared that if symptoms develop or problems develop, that we intervene and make a medical or a surgical intervention. Surgical treatment, the indications for it are an incomplete miscarriage, a missed miscarriage, or a molar pregnancy. Surgical treatment options include a D&C and an MVA. We are going to talk about an MVA. It is considered safer than a D&C. It is more cost effective. It can be performed by midwives. It doesn't need an anaesthetic, though analgesia is required, and there is a reduced risk of perforation. Post-procedure, we need to remember to counsel the woman, tell her what has happened, explain to her, answer her questions. Remember her HIV status. Is she on treatment? Has she actually had a test? And if she hasn't, encourage her to be HIV tested. She will need analgesics and antibiotics. We need to provide contraceptive advice. It's really important as a health worker to write up, to document what has happened, and we need to try to follow her up. Encourage her to come back, or maybe take her phone number if she has a phone, so that you can contact her by phone to ask her how she is. Now, if you have any questions, please ask or contact the facilitator of your course. To summarise, in this module or presentation, we have discussed the elements of post-abortion care. We have discussed the essential care package, and we have considered the treatment options of conservative, medical and surgical. Thank you for listening.